Hello, my name is Jamie Murphy, and today I will be talking about suicide among the early adolescent population. Suicide, we as future counselors know, is an important topic to talk about, whether within our counseling rooms or within the general public. We also realize that this topic is not talked about as often as it should be, and even less so in regards to the adolescent population. Today, I will be revisiting some general knowledge and statistics regarding suicide, as well as focusing on some findings related to perceptions about suicide from adolescents, as well as those interacting with this population frequently, such as teachers and caregivers. Furthermore, we will be looking at how these perceptions can impact preventions and interventions. So before we begin, I want to turn your attention to some definitions from the National Institute of Mental Health that you may be hearing throughout this presentation. Suicide is defined by death caused by self-inflicted behavior, which is the result of intent of death. Suicidal attempts are attempts in which the self-inflicted injury and behavior does not result in death. And finally, suicidal ideation is considered as thoughts, plans, and consideration of self-injurious behavior. So why are we finding it important to discuss this topic today? The American Academy of Child and Adolescent Psychiatry reported in 2018 that suicide is the second leading cause of death for children, adolescents, as well as young adults. The American Foundation for Suicide Prevention also reported that in 2017, 74% of those in grades 9 through 12 had reported at least one attempt in the span of a year. From here, we can stress the importance of having an understanding regarding factors and warning signs before we look into perceptions. It's important to note that as the American Foundation for Suicide Prevention indicates, there's not a single identified cause to suicide. People of any gender, race, age, location, etc. can be a potential risk for suicide behavior and ideation. Further research has shown us that there can be factors that can increase the likelihood of this behavior to occur. We can identify these as risk factors. As we can see above, these are only some, but certainly not limited to environmental, health, historical, interpersonal, social and situational, cultural, etc. Just as there are factors that can increase the likelihood, there are also factors that can help protect the likelihood of these behaviors occurring. These are considered protective factors. These, of course, are some, but also not limited to accessibility for medical attention and mental health attention, support, such as from family and friends, cultural and environmental, as well as strengths, such as ability to problem solve. These factors, both risks and protective, are part of our assessment in the counseling room and should be taken into consideration as we navigate safety for our client. Warning signs. This is another aspect that's important to be aware of regardless. It's important that while there may be stigmas or perceptions about that someone talking about suicide is only looking for attention or they are only mere threats, we really focus on safety here. Looking into potential signs, we can see again some examples above. These are certainly not limited to only these examples as we've discussed with factors in the previous slide. Other specific warnings for the adolescent population also include that children and adolescents may be more likely to make openly verbal statements, decline in schoolwork, lower grades, less participation, change in eating habits, future behavior, such as talking or thinking about plans that go into the future, and we may also see some personality or behavior changes. So from here, we'll be focusing on perceptions about suicide. First, we'll explore perceptions among early adolescents. There were a few pieces from this research that we'll discuss for today. First is helping others versus helping self. A study by Curtis in 2009 found that students in New Zealand reported wanting to help others who were struggling, but it was also noted that those who were struggling themselves were less likely to get help. As one student reported, they think I was weak or mental. So here we can see briefly one example of how there are students who want to help peers, just as the same as we have peers who worry about seeking help. This goes into our next topic, stigmas. As this study, as we just discussed, mentions, students were worried regarding how they would look to others, as well as putting a negative aspect to it. They think I was weak or mental. Another study completed by Hollinger in 2016 with 208 seventh graders found that students who did want to help others reported they did not believe students who were struggling were weak or cowards. So here we can see how important it is to understand how stigmas come into play, particularly for those who are worried about seeking help. Another aspect related to perceptions of early adolescence relates to education and participation. Hollinger completed another study related to preventions in school and found that knowledge regarding suicide varied among students. The researcher then recommends bringing education into prevention models for these students. Another aspect that they found important was that while students agreed prevention efforts were needed, the actual participation in these events were low, which again, research believed may be impacted by stigmas, as we've addressed earlier. So as we begin to consider some of these things regarding helping others versus helping self, as well as stigmas and education and participation, these can further help us in preparing us for recommendations for interventions and preventions. Perceptions of non-adolescents is where we'll focus next. As we discussed before, these are people who are interacting with adolescents on a pretty frequent basis, such as caregivers, teachers, and other school professionals. One interesting find was related to a study on perception of family functioning for patients who had recently been hospitalized for suicidal attempts. In rating family functioning, researchers found that adolescents had worse ratings of this functioning than their caregivers. This showed these ratings were positively associated with scores on Beck's scale for suicide ideation and previous suicidal behavioral history. This can, as the researchers report, not only justify why it's important to include adolescents and caregivers' perceptions of family functioning, but can also relate back to those risk protective factors we have discussed. Another interesting aspect of research was related to teachers and other school professionals. Several studies completed showed that teachers may need further training on knowledge regarding suicide related to myths and facts about this topic. It's important to notate this, as this could impact if a teacher feels comfortable at recognizing at-risk behaviors and students. As Hatton and colleagues reported in 2017, it's important to consider how teachers' perceptions may impact their ability to help identify these students. Furthermore, we can see how it's important to not only include education, but also training, such as letting schools and parents practice having these conversations and continue to build up their skills in providing support for these students. Interventions is where we will focus briefly. Here we can see some of the potential interventions that may come into play within the counseling room. CBT and DBT are some specific theoretical interventions which can help with focusing and working on thoughts and behavior associated with suicide. Recognizing coping skills the client has, as well as building up their toolbox, is also important. Discussing the use of medication with clients and families, including risks, benefits, side effects, are most certainly important. And continuing to have conversations with parents and other social support regarding suicide, myths, facts related to this are also important for us to have. Another one to consider is grief counseling related to if an adolescent did go through a suicide, and how we can support family, friends, teachers, etc. during this time as they navigate their grief and loss. As we have already touched on within this PowerPoint are preventions. As we mentioned, understanding perceptions such as stigmas, comfortability, knowledge, etc. is important to help tailor preventions for teachers and school staff, parents, and even peers. Providing educational experiences, training opportunities, and having these discussions is one large step that we can take. Another aspect related to peers, such as peer gatekeeper programs, which can connect that bridge between the adolescent who's struggling and adult with the help of a peer, are another example of preventions that are currently out there. Another large aspect that we know is related to advocacy, whether it's in the community level or anywhere up to the state or federal level, to help bring attention to this topic. Finally, I will leave with a few recommendations related specifically to future counselors. It's important to continue to expand our knowledge and continue to stay up to date on trainings, laws, and other information that can help us with working with these clients. It's also important for us to remember using our counseling basics to help build a relationship with our client, provide a safe space where they can come and bring up what's going on and feel that they are not being judged. And last but not least, ensuring client safety. This can go from establishing safety plans, focusing on protective factors, and making those calls if a client needs to be hospitalized. Ensuring client is safe and feeling safe are crucial parts to how we can continue to work with these clients. As we have discussed, and perhaps can gain from our own experiences, adolescence can be a struggle in an already stressful world as kids are developing and growing into adults. By providing knowledge and understanding related to perceptions of this population and those that interact with them frequently, we can tailor preventions and interventions related to helping this particular population. Finally, focusing on recommendations and counseling basics can help us as we navigate providing a safe space for adolescents within our counseling room. Thank you.